Today, I was speaking on foot and ankle injuries in elite athletes, anywhere from collegiate to professional. It was a great time, and it was part of the lower extremity session, and just a great group to contribute to the conversation with. As an orthopedic foot and ankle surgeon, I see a number of patients across all ages, from young, pediatric, adolescent, all the way through the geriatric population. But a large component of my practice is dealing with athletes, and particularly elite or professional athletes or semi-professional. And often it is trauma or micro trauma, high ankle injuries, and what we describe as syndesmotic injuries, which can be very problematic, not only for the general population, but particularly for an elite athlete. Obviously, our goal is to help prevent injuries and keep them healthy and get them back to either the field or pitch or the gym that they're functioning on. Some of the athletes and the teams who we're fortunate enough to care for with UPMC Sports Medicine, we really work hard to build relationships, hopefully even prior to injury. Hopefully they never have an injury. But when they do, those initial conversations are really getting to know them, building relationship and understanding what their expectations are, and understanding what they want to get back to, not just for their professional sport and their livelihood, but also the impact of that injury and our treatment for that individual long term. And so we want to take care of the whole patient. That's usually the conversation. How do they want to get back? How did it occur? And what would they define as success? It's variable how long it may take to get someone back after foot and ankle surgery. But in the scenario of a high ankle sprain that we treat conservatively, those can take often anywhere from 4 weeks up to 8 weeks. It's a more severe, high energy type of ankle sprain. And in the event they require surgery or surgical fixation, that usually is a 4 to 6 month return. Sometimes we're fortunate enough to come back sooner, because with a lot of our elite athletes, as I often say, they are built different, both from their biology as well as their mentality. But that is usually the time it takes for us to provide them the best care and to get them back doing what they love. The preventative discussion for foot and ankle injuries with athletes and the weekend warrior is key. Really talking to them about the type of footwear that they use within their particular sport and in their cross training, discussing with them mobility, discussing with them their nutrition, and also talking to them about what type of injuries do they really want to avoid. And so it is a very important discussion to have regarding prevention. Shoe wear, again, is critical, and how they identify and cross-train so that they have the best opportunity to avoid injury. The most exciting aspect of this partnership and, quite frankly, this family of UPMC orthopedic care across Ireland and the US is the two-way exchange. Our ability to learn from one another, to see how we provide certain treatments within the US, but also within Ireland, also driving our research elements and how we really drive preventative care, but also how can we be better with our surgical and procedural outcomes. It's very important. I mean, the more we know and understand from one another, the more we truly can amplify and project not only UPMC orthopedic care, but patient care to our communities.